Hello everyone, welcome back to my YouTube channel, The Disease Decoder. Today our topic of discussion is atelectasis. Atelectasis, also known as lung collapse. As we will start, what is atelectasis? Atelectasis is a partial or complete collapse of a lung or a section of lung. It occurs when the alveoli are the tiny air sacs in the lungs, when the alveoli becomes deflated either due to obstruction, compression, or other factors that leads to impaired gas exchange and reduced oxygenation of blood. Reduced oxygenation of blood. Okay. Atelectasis or lung collapse is a partial or complete collapse of a lung in which alveoli becomes deflated that results in impaired oxygen exchange and that result also results in reduced oxygenation of blood. There are two main types of atelectasis: obstructive atelectasis and non-obstructive atelectasis. As the name indicates, obstructive atelectasis is caused by blockage in the airway, such as due to mucus, foreign body, or tumor, preventing air from reaching the alveoli. As the name indicates, it is due to obstruction. And our second type is non-obstructive atelectasis. It is further divided into four subtypes: compression atelectasis, adhesive atelectasis, cicatricial atelectasis, and microatelectasis. Okay, what is compression atelectasis? Compression atelectasis results from the external pressure on the lungs, such as from pleural effusion, pneumothorax, or tumor. Okay. Adhesive atelectasis. Adhesive atelectasis occurs when surfactant is a substance that keeps alveoli open is deficient. Surfactant is deficient, often seen in acute respiratory distress syndrome. Okay. Our third type is cicatricial atelectasis due to fibrosis of lung tissue, often from chronic infections or diseases like TB, tuberculosis. Our last type is microatelectasis, a diffuse small-scale collapse of alveoli usually seen in patients with acute respiratory distress syndrome or after surgery. There are two main types of atelectasis: obstructive atelectasis and non-obstructive atelectasis. Obstructive atelectasis is due to obstruction from some tumor, foreign body, or tumor. Non-obstructive atelectasis is further subdivided into four types: compression atelectasis, adhesive atelectasis, cicatricial atelectasis, and microatelectasis. Okay. Our next section is about the risk factors. Risk factors of atelectasis. First risk factor is post-operative stages, especially after chest or abdominal surgery, where shallow breathing, pain, and anesthesia can contribute to atelectasis. Okay, our second risk factor is prolonged bed rest. Lack of movements can cause mucus to pool in the lungs, leading to obstruction. Our third risk factor is chronic lung diseases. Diseases like COPD, cystic fibrosis increase the risk of atelectasis. Foreign body aspiration, especially in children, inhalation of objects can block the airways. Our last risk factor is pleural effusion. Pleural effusion is fluid or air in the pleural space can compress the lungs. Okay, our next section is pathophysiology. I would like to draw the structure of alveoli. Let's suppose these are the alveoli. That's what these are the two alveoli in the lungs. What's the pathophysiology of atelectasis? Atelectasis disturbs the normal ventilation and perfusion within the lungs. When the alveoli collapse, they no longer participate in gas exchange. Alveoli collapse in atelectasis. They become constricted in that area. They become deflated. They reduced in from their actual size. That results in hypoxemia. What is hypoxemia? Hypoxia is low oxygen blood levels. In obstructive atelectasis, the trapped air in the air is absorbed in the blood. Okay, it means if there is obstruction in this place and the air is trapped in the alveoli, the air becomes absorbed in the blood that's present here. Okay, and that results in deflation, means collapse of the alveoli, causing the alveoli to collapse. In non-obstructive atelectasis, like in that case, the external pressure of surfactant reduces the lung ability to stay in. Okay, the pathophysiology of atelectasis. Our next section is about the signs and symptoms of atelectasis. Our first sign and symptom is dyspnea. What is dyspnea? Dyspnea is the shortness of breath. Shortness of breath, especially in large area of the lung. If large area of the lung is involved, our second sign and symptom is cough, often dry, resulting from irritation of the airways. Our third risk factor is trachepnea. Trachepnea means rapid breathing due to decreased lung capacity. Cyanosis. What is cyanosis? Cyanosis is a blue discoloration of the skin indicating low oxygen levels because there is no oxygen or gas exchange here in the alveoli. That's why the color of the skin becomes bluish. Our next sign and symptom is chest pain, particularly if the atelectasis is associated with pleural involvement. Our second last sign and symptom is decreased breath sounds noticed on physical examination over the affected area. Dullness on percussion. As we know, there are four methods in examination: inspection, palpation, percussion, and auscultation. When we do percussion over the collapsed area of the lungs, we hear dull sound. These are the main signs and symptoms in atelectasis. Okay, our next section is ways of diagnosis. What are the common ways for diagnosis of atelectasis? Our first way is chest X-ray, the most common diagnostic tool showing areas of lung collapse and displacement of structures like the mediastinum. Our second way of diagnosis is CT scan, provides more detailed images helpful in identifying underlying causes like tumors or foreign bodies. After third way of diagnosis is bronchoscopy. Bronchoscopy used to visualize the inside of the airways and remove any obstruction. Our last way of diagnosis is ultrasound, especially useful in detecting pleural effusions that might be compressing the lungs. Last section of our this presentation is about the treatment. There are three ways of treatment. First, physical interventions. Second is medication, and third treatment is surgical intervention. First, we talk about the physical intervention. Uh, First way in physical intervention is chest physiotherapy. We try our best to treat the patient with chest physiotherapy. Second is incentive spirometry, and third is bronchoscopy. We try to open the airways with the help of bronchoscopy. Uh, our second way of treatment is medications. In medications, first we use bronchodilators. Bronchodilators are used in cases where airway obstruction contributes to the atelectasis, especially in patients with asthma or COPD. These medications help to relax muscles around the airways, improving airflow to the lungs. Second are mucolytic agents. Mucolytic agents may be prescribed to thin or loosen mucus, making it easier to clean from the airways, particularly on obstructive atelectasis. Our third medication is antibiotics necessary if the atelectasis is associated with bacterial infection such as pneumonia. Our fourth medication is analgesics. Pain management is crucial, especially in post-surgery, to ensure patient can breathe deeply and cough effectively. Appropriate analgesia can prevent atelectasis from worsening. Our last medication is corticosteroids. Corticosteroids are used to reduce airway inflammation, particularly in cases where asthma or COPD is present. Okay, these are the most commonly used medications in atelectasis. Our last way of treating atelectasis is surgical intervention. Surgery is the last part, it is not common. Surgery may be required to remove tumors or other persistent obstructions causing atelectasis. Okay, let's summarize our lecture, our today's presentation. What is atelectasis? Atelectasis is a partial or complete collapse of a lung that results in alveoli becomes deflated, impaired gas exchange that ultimately results in reduced oxygenation of blood. There are two main types of atelectasis: obstructive atelectasis and non-obstructive atelectasis. Obstructive atelectasis is due to obstruction from anything like mucus, foreign body, or tumor. Non-obstructive atelectasis is further subdivided into four types: compression atelectasis, adhesive atelectasis, cicatricial atelectasis, and microatelectasis. Okay. Then we talked about the risk factors of atelectasis, post-operative status, prolonged bed rest, chronic lung disease, foreign body aspiration, and pleural effusion. Then we talked about the pathophysiology. In both cases, both obstructive atelectasis and non-obstructive atelectasis. Then I talked about the sign and symptoms like dyspnea, cough, tachypnea, cyanosis, chest pain, decreased bed sounds, and dullness on percussion. Our next section was ways of diagnosis. There are four common ways of diagnosis: chest x-ray, CT scan, bronchoscopy, and ultrasound. Then I talked about the treatment options. There are three treatment options: physical interventions, medications, and last, surgical interventions. In physical interventions, we use chest physiotherapy, incentives, spirometry, and bronchoscopy. In medications, we use bronchodilators, mucolytic agents, antibiotics, analgesics, and last, corticosteroids. And our last method of treating atelectasis is surgery. I hope you enjoyed the video. If you liked the video, don't forget to watch other videos of my channel, the disease decoder, and don't forget to share with your friends so that they can enhance in their clinical skills too. Thank you.